Yeah. We do all feel sad, sometimes we feel dull when we suffer from some downs in life, but that doesn't mean that we are clinically depressed. So, the diagnosis of depression is given when certain criteria are fulfilled. The most important is the persistent sadness of mood, which is present for most of the day for at least 2 weeks. So, we cannot call a patient is suffering from depression before 2 weeks. In addition to this, some of the more criteria are present. For example, easy fatigability, easy irritability, the ideas of hopelessness, helplessness, worthlessness, excessive and inappropriate guilt is sometimes present. The person gets crying spells on and off without any reason. Persistent preoccupation with same kind of thoughts is seen. And sometimes multiple body pains for which we cannot find any reason are present. And invariably depression is accompanied with anxiety. So anxiety means lot of restlessness is seen, lot of palpitations, tremors, and excessive perspiration is seen. In severe cases of depression, what we find commonly are the suicidal ideas, along with that the psychotic features like auditory hallucinations. A person hear voices which are inaudible to others are seen. And this depression should cause significant deterioration in socio-occupational functioning. Then only we call it as clinical depression. Look, there are not definite causes or reasons for depression, but what we call are the risk factors. So, if some member in the family is suffering from depression, there is a high chance that a person may be a victim of depression. Secondly, certain medical disorders like hypothyroidism or hypopituitarism makes a person make more prone for depression. Then certain risk factors like, as I stated earlier, financial loss or problems at job are the external stressors which are present and make you prone for depression. But in some cases there are no stressors also found. In such cases where there are no risk factors and still the person is suffering from depression, we call it as endogenous depression. There are few more other factors like childhood adversities. If someone has lost the parent before the age of 11 years or child sexual abuse is one of the cause for depression. But the final common pathway where all depression patients lead, where internal pathology is located is the same. It's at the serotonin and norepinephrine level. These are the happy neurotransmitters which are found deficient in depression. So our therapy or any treatment is based on this only to uplift the level of serotonin and norepinephrine. For treating depression, we need to consider a lot of factors. For example, the patient choices, the therapist choices, other medical comorbidities presented by patient and the kind of depression. Some depression is present with decreased sleep, some is present with increased sleep. For some patient the anxiety control is more important. Depending on that we choose the treatment. For mild depression, even psychotherapy, that is counseling, a mode of counseling or cognitive behavior therapy is sufficient. In some cases we just go for exercise and diet. What exactly psychotherapy does, when you are depressed, you are having issues with thoughts. So your thoughts are dysfunctional or depressed, that's why your emotion is depressed. What we do in psychotherapy is uplifting the thoughts and emotions are uplifted as a result of that. So the depression comes up. During exercise what happens, lot of happy hormones called as endorphins are secreted in the brain, which are natural mood lifters, which cause lot of improvement in depression. Similarly, diet enriched with milk and fruit releases lot of tryptophan, which in turn causes upliftment of serotonin. But in moderate to severe cases, we have to use antidepressants and anti-anxiety medicines. As opposed to the popular belief, those are habit forming, need to be taken for lifetime, those are basically sleeping pills. With the modern Midas touch of psychiatry, we don't have such kind of antidepressants, and the modern antidepressants are to be taken for shorter period of time, the immediate relief is obtained with less side effects. Even if the side effects tend to happen, they happen for very less period of time and tend to go off very soon. So my request is to consult a proper mental health care provider if you are suffering from depression. We can 100% cure it if diagnosed in time and treated in time.